Good morning, everyone. Later this week, COVID-19 is expected to crest in our region. What that looks like exactly, we do not know, but sadly it will translate into more positive tests and more deaths. A crest will be followed by a plateau, meaning the virus will continue its stronghold in our community. Until we have more testing to understand how deeply this virus has penetrated our community, we cannot weaken the rules that by doing so would jeopardize public safety. That's why I had no choice but to extend the county's stay-at-home order that was set to expire today. Last week I announced the stay-at-home orders would stay into place indefinitely and we would reevaluate in mid-May. Mayor Kruzan extended stay-at-home orders for the city of St. Louis, and Governor Parson extended stay-at-home orders for the state of Missouri. The governor's stay-at-home order is effective until May 4th. We will be continuously reevaluating the situation and the data here in St. Louis, and of course we will do so again around the governor's date of May 4. We've had a lot of questions about when and how we will ease our safety restrictions in our state, and that is a continuous evaluation. Dr. Garza said in his briefing yesterday with the St. Louis Metropolitan Pandemic Task Force, we must be sure to do this the right way. We don't get a second chance to do this right. I've seen the media coverage of the protests, including the one here in Clayton yesterday. And I know people are anxious to get back to the way it was before COVID-19. This pandemic has taken a devastating toll on our economy, and we are in discussions right now about what a gradual reopening would look like. Mayors across the county are anxious, and I've talked with more than 65 of them on helping to craft a path forward. Our business leaders are also working with me in a way to design a safe process for getting more businesses open in our community and more people back to work. Our Department of Public Health is putting together guidelines as well to help our businesses open in a safe way with cleaning protocols, crowd size guidelines, and social distancing discussions. I've also worked with our Parks Director since we decided to close the parks, talking about what a gradual reopening of our parks might look like. We could perhaps start with trails, but I'll have something to announce later this week or early next week. Everyone I talk to wants to know again, when will we get back to the way it was pre-COVID-19? I would like to give it a definitive answer, but I can't. I'm following the lead of our healthcare professionals, our community leaders, our hospital systems, and we're all keeping tabs on the number of admissions to hospitals, ICU admissions, the number of people on ventilators, and the number of positive tests. More testing gets us more quickly to the answer that we need on how long this goes. And as history has shown us, viruses seldom come and go quickly. They are often here for second and third waves. We can't let our guard down, and we can't do all the great collaborative work that we've done here in St. Louis. We've seen how this virus has affected the coasts and affected other communities around the globe. Once we are comfortable that this virus is under control, then we can start to look at what reopening our community will look like. But we're not there yet. Last night, the County Council advanced two important pieces of legislation. First, to allow $7 million to be transferred out of our health fund to buy tests and other supplies to continue our efforts. The second bill allows the county to set up a special fund to receive a $175 million grant and to track that on a portal that anyone can access online and watch how it's being spent and utilized. We are expected to receive this federal grant on Friday. The bill will also allow us to create a web portal for the public to keep tabs on all of this, as we discussed, and that this grant will serve as a lifeline to our communities. Work on this portal is underway, and we should be able to announce this as the council passes the appropriation bill. This is a public health crisis. As I told the council last night, if we don't move with urgency, we will once again be put in the position of repeating history and leaving some of our most vulnerable communities behind. As we have seen here and across the country, COVID-19 has affected our African American communities disproportionately. We need to provide more outreach and make sure that tests and access to testing centers is available. Testing on demand will allow us to pivot towards reopening our communities and getting people back to work. With this CARES Act grant, we can move quickly to provide people with the testing and the care that they need. This grant can only be used for COVID-19 related expenses, and the money must follow the federal guidelines and will be overseen by the U.S. Inspector General. This grant will be used exclusively to help our community recover from the healthcare crisis, the humanitarian crisis, and the economic crisis. This is like anything we have never seen before. Together we will get through this. Together we will come back stronger. And together we must continue to follow the restrictions that are in place so we don't undo all of our good work. I'd be glad to take any questions.
Now, there were fewer cases reported in the county from a few weeks ago. Is that a lower rate because you're only testing more people, or is that really just people having it?
Well, that is the question that we've always asked ourselves. We know testing is inadequate in our country, and testing is inadequate in our community. The supply of testing materials is not keeping pace with the consumption and the need for those testing materials. We still have restrictions, some limited restrictions on who we can test. We're not able to test everyone who's symptomatic, but we'd like to open it up to do that. And we'd like to be able to test more people in general. And we'd like to be able to test our community to see who's already had the virus and who may have developed some sort of possible immunity. There are two main types of tests: serology testing for someone who might have been exposed and might be developing immunity, and then an acute testing or testing for someone who is contagious at this point.
So the number of people being tested, is it going up or going down?
The testing results, the exact date on the testing results is on our website, but we are still limited in supplies. We have a few more testing supplies. We're gradually increasing our testing supplies. The market to purchase testing supplies is extraordinarily competitive. We're competing with other parts of the country. We're competing with the federal government, and we need to be aggressively in that space. Testing is the key to identifying people who are sick, to getting them treated, and to getting our restrictions, our safety restrictions listed, because testing, isolation, quarantine of close contacts is the proper way to treat an epidemic in the 21st century.
When we hit May 4th, and the governor has announced how he wants to start reopening, yours will stay in place until mid-May. When we have that disparity between the two stay-at-home orders, the state one and the county one, do we know which one holds more weight, which one supersedes which?
Yes, the governor has stated in the past and will continue to clarify that he will leave it up to local jurisdictions who are more impacted by COVID-19 infections to continue with their own local orders. We know here in St. Louis County, over a third of the cases in the state of Missouri are here in St. Louis County, and we have less than a sixth of the population. We are disproportionately impacted here, and we will be following closely here in St. Louis County the advice of our public health officials, our health systems, and our community leaders as we decide on how and when to lift our restrictions and our safety orders.
What are your thoughts of Franklin County opening up to some businesses, I believe on Friday? And then is there worry that some county residents can go other places who don't have some of those stay-at-home orders in place and then coming back here to the county?
Well, Franklin County will lift some of their restrictions, what I've read and seen, again with restrictions on movement and crowd sizes. Franklin County is different than St. Louis County. We have many, many more infections, many, many more hospitalizations here in St. Louis County. We'll certainly be watching the situation closely and how it might impact us, but we're very focused on the number of infections in St. Louis County, and we're going to very closely follow the advice of the doctors and public health officials and our health systems.
Last question
Questions?
I have. When do you think you'll be able to give us a dollar amount as it relates to how much money has been spent on COVID?
I think that website will be up in a few days. We have almost $7 million of obligations or encumbrances or bills that are due. Probably have paid less than $1 million of bills. We will be combing through our expenditures since March 1st to see if anything else is eligible for reimbursement. We've really been focused on saving lives for the past 8 weeks and finding the funds somewhere in some budget to get us started and keep us going with PPE and testing. But as we get moving, as that federal grant arrives on Friday, we'll be developing the infrastructure to monitor the expenditures, monitor the reimbursements, and all of that will be publicly available. And I expect that to be up within a few days. Any other questions? Doug, anything? Okay, thank you everyone.